Hello everyone, welcome back to my channel. Are you a man over 50, struggling with erectile dysfunction? You're not alone, and there is hope. In today's video, we're revealing the best proven exercises to help fix erectile dysfunction naturally, improve blood flow, enhance stamina, and boost confidence, all without relying solely on pills or medications. In this educational video, we break down simple yet powerful exercises that have been scientifically shown to improve erectile function by targeting key systems like pelvic floor strength, cardiovascular health, and circulation. These exercises are safe, easy to perform at home, and specifically tailored for men over 50. So let's get started. Top exercises to fix erectile dysfunction naturally. Number 1. Kegel exercises. Strengthen your pelvic floor. Are you over 50 and experiencing issues like erectile dysfunction, urinary leakage, or a weak bladder? If so, you're not alone. One of the most powerful, natural solutions to these problems lies in a simple but often overlooked exercise: Kegel exercises. Kegel exercises are targeted movements that strengthen the pelvic floor muscles, especially the pubococcygeus muscle. These muscles support the bladder, bowel, and sexual organs, and they play a crucial role in erectile strength and bladder control. By learning to properly contract and release these muscles, men can improve blood flow, stamina, and muscle tone in the pelvic region, all essential for a healthy sex life and urinary system. How to find your pelvic floor muscles. Step 1. The next time you're urinating, try to stop the flow midstream. The muscles you use to do that are your pelvic floor muscles. Step 2. Once you've located them, practice contracting and relaxing these muscles without holding your breath or squeezing your stomach, thighs, or buttocks. When and where to practice. While sitting at your desk. While lying down relaxing. During your daily walk or commute. While watching TV or brushing your teeth. Because these exercises are invisible to others, you can do them anytime, anywhere. Benefits of Kegel exercises for men over 50. Improved erectile strength and rigidity. Better control over ejaculation. Reduced risk of urinary leakage and urgency. Stronger pelvic support for prostate health. Boosted confidence and sexual satisfaction. These exercises are discreet, easy to do anywhere, and don't require any equipment, making them perfect for men over 50. How to do Kegel exercises. Beginner routine. Contract your pelvic floor muscles for 3 to 5 seconds. Relax the muscles for 3 to 5 seconds. Repeat 10 times for 1 set. Aim for 3 sets daily, morning, afternoon, and evening. As your strength improves, increase the duration of each contraction up to 10 seconds and perform more repetitions. Important tip: don't overdo it. Start slow and stay consistent. Overworking your muscles can cause fatigue or soreness, just like any other workout. Bonus tips to maximize results. Combine Kegels with deep breathing to reduce stress and enhance relaxation. Drink plenty of water and eat a fiber-rich diet to avoid constipation, which can weaken pelvic muscles. Pair with cardio and strength exercises for full body health and better blood flow. Be patient, results usually appear in 4 to 6 weeks with consistent practice. Have you tried Kegel exercises before? Let us know your experience or questions in the comments below. We're here to help you take control of your health naturally. Number 2. Leg raises. Activate lower core muscles. Leg raises are an excellent way to activate the lower abdominal muscles, support pelvic health, and improve circulation in the lower body, all of which contribute to better sexual performance and stronger erections. Whether you're just starting your fitness journey or looking for targeted exercises to enhance your health after 50, this exercise is for you. How to perform leg raises properly. Step-by-step instructions. Lie flat on your back on a mat or firm surface. Place your arms down by your sides for balance. Keeping your legs straight, slowly lift both legs off the ground to about 45 to 60 degrees. Hold for 1 to 2 seconds at the top. Lower slowly, without letting your feet touch the ground. Repeat for 10 to 15 reps per set. Complete 2 to 3 sets, resting 30 seconds between each. Tip: keep your lower back pressed into the floor to avoid strain and maximize core engagement. Why leg raises matter for men over 50. As we age, especially after 50, the lower abdominal and pelvic muscles weaken, and fat tends to accumulate in the belly area. This not only impacts your posture and energy but also negatively affects sexual performance and blood circulation to vital areas. Leg raises target the lower core, helping to strengthen deep abdominal muscles, increase blood flow to the pelvic region, support better control and endurance during intimacy, improve core stability and posture, reduce belly fat, and boost testosterone naturally. Common mistakes to avoid: lifting your head or arching your lower back, using momentum instead of controlled movement, holding your breath, remember to breathe naturally, rushing through reps, slow and steady wins the race. For maximum improvement in erectile function and stamina, pair leg raises with Kegel exercises, pelvic floor training, walking or light cardio for heart health, squats or resistance training for hormone balance, a clean, anti-inflammatory diet. Doing leg raises just 3 to 4 times a week can bring noticeable improvements in your core strength, blood flow, and sexual performance in just a few weeks. Stay committed, you'll feel the difference. Number 3. Brisk walking boosts circulation. Walking is more than just a daily habit, it's a science-backed tool for better vascular health, especially important for men experiencing erectile dysfunction (ED). And the best part? It's free, safe, and easy to incorporate into your routine starting today. How to get started with brisk walking. Step-by-step guide. Start slow, begin with 10 to 15 minutes per day if you're just starting out. Walk at a brisk pace, aim for a pace that makes you slightly breathless but still able to talk. Swing your arms naturally and keep your posture upright. Breathe deeply through your nose to oxygenate your blood. Gradually work your way up to 30 to 45 minutes per day, 5 days a week. With consistent brisk walking, most men report improved erections and stamina, lowered blood pressure and cholesterol, reduced belly fat, increased daily energy, better sleep, and mood. These benefits can begin to show in as little as 3 to 4 weeks, when combined with a healthy diet and other supportive habits. Why brisk walking works for erectile health. As men age, blood vessels lose elasticity, and blood flow to the pelvic region declines. Erectile dysfunction is often a circulatory issue, not just a hormonal one. Brisk walking helps by enhancing blood vessel function, reducing blood pressure, and improving heart health, lowering stress and anxiety, which can block erections, burning belly fat, which is linked to low testosterone, stimulating natural nitric oxide production, improving blood flow. Studies have shown that walking just 30 minutes a day can significantly reduce the risk of ED in men over 50 and boost overall energy and vitality. Bonus walking tips for better results. Walk in the morning sunlight. This boosts vitamin D, supports testosterone, and lifts mood. Choose natural settings. Walking in a park or green space reduces stress more than walking indoors. Wear comfortable shoes with good arch support to prevent joint strain. Add music or podcasts to make your walk more enjoyable. Pair walking with deep breathing or mindfulness to calm the nervous system. Brisk walking is a foundation of lifelong health, easy to begin, powerful in results. Combine it with other exercises like Kegels, leg raises, squats, and yoga to naturally restore your confidence, vitality, and sexual performance. Number 4. Squats, natural testosterone booster. Want to boost your testosterone levels naturally, build strength, and improve erectile health, especially after 50? Look no further than squats, one of the most effective, full-body exercises for men of all ages. Doing squats regularly can support hormone balance, increase blood flow, and reignite physical vitality, all without the need for supplements or medication. As men age, muscle mass declines, testosterone levels drop, and circulation becomes less efficient. These changes contribute to fatigue, weight gain, and erectile dysfunction. But the good news: squats can help reverse many of these effects naturally. How to do squats safely and effectively. Step-by-step guide for beginners. Stand with your feet shoulder width apart. Keep your chest lifted and your back straight. Slowly lower your body by bending your knees and hips like you're sitting in a chair. Go as low as comfortable, aim for thighs parallel to the ground. Pause briefly, then push through your heels to return to standing. Perform 2 to 3 sets of 10 to 15 reps, resting 30 to 60 seconds between sets. Tip: start with bodyweight squats, and once comfortable, progress to dumbbell or resistance squats for added benefits. Squats don't just boost testosterone. They also burn more calories and support fat loss, strengthen joints and prevent age-related muscle loss, improve mobility and prevent falls, increase stamina for physical activity including intimacy. Why squats are essential after 50. Squats are not just a leg exercise, they're a hormone-boosting, blood-pumping powerhouse. When done correctly, they activate large muscle groups, like the glutes, quads, hamstrings, and core, triggering your body to release more testosterone and growth hormone, 2 key factors for male vitality. Here's what squats help with. Boost natural testosterone production, improve blood flow to the pelvic region, increase lower body strength and stability, support prostate and erectile health, reduce belly fat, which is linked to ED and low testosterone, enhance overall endurance, posture, and energy. With just 10 to 15 minutes of squats, 3 to 4 times a week, many men begin to notice improved strength, better erections, more energy, and better body composition in as little as 3 to 6 weeks. Consistency is key. Stick with it, and let your body do what it was designed to do. Number 5. Yoga, relaxation plus blood flow. Struggling with stress, poor circulation, or erectile issues after 50? Discover the healing power of yoga, a gentle, yet powerful practice that can help restore your body, calm your mind, and naturally improve sexual health. We'll guide you through simple yoga poses that support blood flow, reduce anxiety, and strengthen the pelvic region, all key elements for reversing erectile dysfunction without pills or side effects. Best yoga poses for erectile health. Here are some beginner-friendly poses included in this video. Cobra pose opens the hips and stimulates pelvic blood flow. Bridge pose strengthens glutes, lower back, and pelvic muscles. Seated forward bend stretches the hamstrings and calms the nervous system. Legs up the wall reverses blood flow and promotes relaxation. Child's pose relieves stress and tension from the lower back and hips. Benefits of yoga: improves posture and spinal alignment, enhances mental clarity and sleep quality, supports prostate health and digestion, encourages mindfulness and emotional balance, helps manage blood pressure and chronic inflammation. Why yoga matters for erectile function and aging. As we age, the body tightens, circulation slows down, and stress levels often rise, creating the perfect storm for erectile issues. Yoga helps to increase blood circulation to the pelvic region, reduce stress, anxiety, and cortisol levels, open up tight muscles, and improve flexibility, balance hormones like testosterone, strengthen core and pelvic floor muscles, support heart, lung, and nervous system health. All of these benefits directly impact erectile function, stamina, and confidence. How to practice yoga. Start with 10 to 15 minutes a day. Practice on a soft mat, in a quiet, peaceful space. Use deep, belly breathing with each movement. Avoid forcing or pushing your body, let it unfold naturally. Focus on relaxation, not perfection. Consistency is key. Practicing just a few times a week can lead to noticeable results in circulation, flexibility, and sexual vitality. Most men begin to experience better relaxation, energy, and sexual health within 3 to 4 weeks of regular practice. With time, yoga becomes more than a workout, it becomes a way of life that supports your overall vitality. Number 6. Swimming, full body blood flow booster. Looking for a fun, joint-friendly, and highly effective way to boost circulation, increase stamina, and support erectile health after 50? Look no further than swimming, a total body workout that's gentle on your joints and powerful for your heart, hormones, and sexual function. Whether you're dealing with poor circulation, fatigue, or declining libido, swimming can reignite your vitality from head to toe, no pills required. How to swim for erectile and overall health. Beginner tips for men over 50. Start slow, swim 2 to 3 times per week for 20 to 30 minutes. Try basic strokes, like breaststroke, freestyle, or backstroke. Warm up and cool down with slow laps or water walking. Focus on smooth, controlled breathing throughout your session. If swimming laps is difficult, start with aqua jogging or water aerobics to build endurance. With consistent swimming, most men notice improved erections and stamina, more energy and motivation, better cardiovascular fitness, reduced weight and belly fat, enhanced overall mood and stress relief. You may start feeling the benefits within 3 to 5 weeks, with more noticeable changes in blood flow, libido, and endurance in 6 to 8 weeks. Why swimming is a game changer for men over 50. Swimming is more than just a cardio exercise, it's a full body movement that increases blood flow, strengthens the core and pelvic region, and improves oxygen delivery throughout the body. These effects play a key role in reversing the root causes of erectile dysfunction. Here's what swimming helps with. Enhances circulation to the pelvic and genital areas. Supports heart health, stamina, and vascular function. Lowers blood pressure and cholesterol naturally. Reduces stress hormones like cortisol. Improves lung capacity and oxygen efficiency. Burns belly fat, which can lower testosterone. Swimming also works wonders for your mental health, helping reduce anxiety, improve sleep, and promote relaxation. Since stress is one of the most common causes of erectile dysfunction, reducing it naturally through swimming can bring long-term improvements in performance and satisfaction. So there you have it. Best exercises you must try to get harder erections. Why these exercises work. As men age, circulation declines, pelvic muscles weaken, and stress increases, all factors that contribute to ED. These exercises help by increasing nitric oxide and blood vessel flexibility, reducing stress and anxiety, strengthening muscles involved in sexual function, supporting hormonal balance naturally. Alongside exercise, don't forget to eat a heart-healthy diet, rich in fruits, vegetables, and omega-3s. Get quality sleep, 7 to 9 hours, stay hydrated, and manage stress levels. Have you tried any of these exercises before? Share your experience in the comments below. Don't forget to like, subscribe, and turn on notifications so you never miss content that helps you live stronger, healthier, and more confidently after 50. Subscribe for more videos on men's health, fitness, circulation, and energy after 50. This video is for educational purposes only, and not a substitute for professional medical advice. Please consult your doctor before beginning a new exercise regimen, especially if you have heart issues, high blood pressure, or haven't exercised in a while. Thanks for watching.